Next on Fox 45 Morning News.
At 3 months old, one little boy underwent life-changing facial surgery to repair cleft palate issue. It's a birth defect that more than 4,000 infants are born with every single year. That's according to the CDC. Surgery is the only option, yet many choose not to do it. In this week's Family 411, Dr. Randy Capone with GBMC, who performed this surgery, is here along with little Kian Patel and his mother, Vipra. Good morning, guys. Thank you all for being here.
Thank you.
And let me say congratulations to you. He is adorable.
Thank you.
I know he's 5 months old. It's been 2 months since the surgery. How are things going?
It's been a rough journey, actually. You know, when he was born, he had a lot of feeding issues and things like that. And then since the surgery, we did have to go back to the hospital because he got RSV and stuff. But since the surgery, he actually has, you know, his feeding has improved much, and he looks great. I mean,
he really does.
I mean, he looked great before too, but you know,
he's beautiful.
Yeah.
What made you decide to do this? I know a lot of parents don't do this. What was your decision maker?
Well, I think the fact that if kids, you know, they don't get the cleft lip repaired, then they tend to have a lot of feeding issues, speech problems, things like that. And, you know, by going to the Cleft team and everything, we were able to find out that the earlier that they do an intervention, the better the outcome is for these kids.
And Dr. Capone, 4,000 kids every single year are born with this. Right. You know, what do you have to say to parents who are watching little Kian and thinking he looks so great? Any advice for them, thinking if they should do it or not?
Yeah, I think there's really no question. I think every patient, every family should do this. It's very fixable, and it is a process, like Vipra said, but very fixable and with very good outcomes.
What is that process like, the procedure and, you know, the length of it?
The lip surgery is usually done at about 3 to 4 months of age, sometimes a little bit earlier, depending on the health of the child. And usually it's about a 2-hour surgery, and sutures come out about a week later. They have little elbow immobilizers that keep their arms kind of immobile for a while so they don't play with the stitches. And then it's about a 1-year healing process thereafter. So he's a few months out now, 2 months out, so he's still got healing to do.
As far as little Kian in his life, as he grows up to be 5, 10, 15 years old, how do you think that this will affect his life and kids like him who get this repaired?
I think it's dramatic. You know, to go through life with a facial deformity right in the center of your face that everybody can see is quite a detriment. So to fix this and moving forward, I think is a very straightforward decision, and he's going to, I think, do very well.
It's a success story for him. As the mother, you've got to be feeling great. What do you see for his future now? Oh,
you know, I expect him to just be like any other child. He loves the water, so we figure definitely he'll be a swimmer when he grows up.
Are you going to be a swimmer? Maybe? You're saying yeah? Well, again, congratulations to you and your family. We're so glad it went well. And Dr. Capone, thanks for spreading the word. Hopefully it helps some of you if you're dealing with that issue. Thank you.
Thank you.
If you'd like more information on cleft palate, please log on to our website, foxbaltimore.com/morning. As always, all of that content on our website is free. And if you have an idea for our next Family 411 segment, send me an email.